Thank you. It's a pleasure to be here. 25 years sounds like a long time to me. But I want to tell you a story about very early in my career where I saw a young girl with diabetes. She was 16, and I was working as a dietitian. And she came into my office alone. Her parents weren't with her or any of her family. And so we talked about her diet, and I probably talked to her about the exchange list. And she was what, at the time we called non-compliant, which is a horrible word to use. She was having a lot of trouble following her treatment plan, and I probably gave her the little dietitian thing and sent her on her way. And I found out a couple weeks later that this girl had not woke up in the morning due to hypoglycemia. And that's haunted me all these years about whether, did I ever mention to her that this could happen? Or did anybody talk to her family that this was a possibility? And that's kind of driven my career from then on in terms of making sure that patients are empowered with information. What they do with it is up to them. But making sure that they have the information and understand what the important things are to do to care for yourself. And interesting what Carrie said in terms of what she found out when she first started looking for information about diabetes, and you hear all these horrible things about what diabetes can do to you. And I like to say that yes, if you don't take care of yourself, and diabetes is really a self-cared for disease, that yes, you can have some horrible complications. But I also like to say what my friend Bill Polanski, who's a very prominent psychologist and certified diabetes education in the area, and he asked the question, and what are the complications of well-managed diabetes? None. So that's what we want to make sure is that people have the tools and the information that they can manage their disease and hopefully not suffer from any of the complications. So I want to talk a little bit, I'm just going to introduce Novo Nordisk and our role with Juvenation, and most of the rest of the time that we have I want to give to Rachel to talk about the site. Just to give you some idea, Novo Nordisk is a global healthcare company. Our home office is based in Denmark, but in the United States we're the largest affiliate. We have products that are marketed in 179 countries. We're the only company with a comprehensive portfolio of insulin analogs. And we also are an innovator in easy-to-use insulin devices. Our global aspiration is to defeat diabetes by finding better methods of diabetes prevention, detection, and treatment. And obviously, we can't do this alone. We need to engage with partners in a lot of different arenas, and that's what led us to work with JDRF. We had a relationship with JDRF for many years, mostly in support of their fundraising efforts, but we were taking a look at if there was another way that we could support JDRF, and that's how Juvenation came about. Another thing that was driving us in terms of with Juvenation is that we have a major global leadership initiative called Dawn Youth. Now, about 9 years ago, we had done a study on adults called the Diabetes Attitudes, Wishes, and Needs Study. It was done globally, where we asked specific questions about diabetes care for adults. But diabetes for children is a much different situation. So in 2007, we did a study, an online survey with 8 countries, and we surveyed young adults between the ages of 18 and 25, their parents or caregivers, and healthcare providers. And what we found out was, with a lot of variation around the world, but that there were some real gaps in care for children with diabetes and young adults with diabetes. So the main focus for action with our Dawn Youth program is to take a look at what some of the issues are with schools. When kids with diabetes go to school, as you probably know, a lot of times kids can't carry food in their backpacks, they can't have food available, they can't have any medication. There's all kinds of rules that can have an impact on a child managing their diabetes at school. Also, attention to psychosocial support. Diabetes doesn't just affect the child or the young person in the family. It affects the parents, it affects the siblings, it affects the grandparents. So addressing some of those issues. Also, that peer support was a real important aspect of dealing with diabetes, as Carrie mentioned, how important it was for her to finally have some people that understood exactly where she was coming from. And also to start taking a look at the growing rate of type 2 diabetes and obesity with kids. So these are the main focus actions for Dawn Youth. We like to think that through our Dawn program we are listening to the voice of patients and putting some programs into place to address those. So as I said, we are innovative in diabetes. Our passion is around diabetes, and it's important for us to engage partners to help us extend to hopefully reach our aspiration. So I'm going to turn it over to Rachel now to give you the details of juvenation.org.